Hey guys. So I wanted to come on and do a quick video. So I have back to back to back to back to back clients today. It's a Saturday and I am just 100% focusing on my nutrition business today. So you all know that I still work as a school nurse. So I still have my 9 to 5, but after my 9 to 5 and on the weekends is when I really get to dive deep into my business. So I'm starting a group coaching program Monday. And then I also have some clients that I'm working with. So today is like my catch up day to do all my Zooms and check in with my clients. So I have somebody literally in like less than 15 minutes. So I thought I would just hop on and do a quick video. And then that would force me to not be so long winded since I have to be on a Zoom in a couple minutes. So something that came to my mind was work ethic. And I just thought about and just how the importance of not being a product of your environment when it comes to work ethic. So I was just kind of thinking about how when I first started on the unit, because you all know I worked in med-surg first when I became a nurse, and then I went to the intensive care unit. So I was in the med-surg for less than a year, and then the rest of my hospital career, which was about another 2.5 years, I did intensive care unit. So when I first got on the med-surg unit, I feel like my work ethic was like top tier. Like I just feel like I went above and beyond for my patients. I mean, I just tried to be super nurse. And over time, I did get a little burnt out with that because I just think that taking care of people can be really depleting. I think even when you have like good people that you take care of, like good-hearted, whole people that do what you say and, are just good people, like it can still be super draining and depleting. And so on top of that, just your patients draining you, sometimes the environment you're in can be draining and it can be toxic. So I saw when I worked in the hospital, and this was all, of course, pre-COVID, I just saw a lot of nurses that were burnt out. And many of them, the ones that I worked with on the med-surg floor, and even when I went to the intensive care unit, many of them had been in the profession for years. And they were like me, came out of nursing school, went straight to the unit. And there were actually on both units, there were quite a few nurses that had been there. I mean, I think one nurse when I was on med-surg, she had been there like 15 years. And then even when I went to my other unit, the one that I really loved, the intensive care unit, there were several nurses that had been there for a decade or more. So, but I think that, like I said, taking care of people is really draining, and nursing in general is draining because of just what you have to deal with doctors, with imaging, with seeing a lot of death. Dealing with families, it can just be very draining and it can take a toll on you. But a lot of people don't want to walk away from the hospital life because you do have so much flexibility. You are only obligated to work 3 days, and if you want overtime, it's easy to get because we were always short staffed. And a lot of people don't want to go to the Monday through Friday 8 to 5 lifestyle. And now being in that Monday through Friday lifestyle, like I really understand why people stay in the hospital even though they're miserable, because I don't like Monday through Friday 8 to 5. I loathe it, but because of my health and because of just other factors, I had to move on to a Monday through Friday 9 to 5. So but anyway, I say all that to say that I had this high work ethic, but my environment and just over time dealing with people somewhat, I'm not gonna say it made me become a little lazy, but it tempted me to become lazy. It really did. I wanted to kind of slack off of my work ethic because I'm like, the people around me ain't working hard and they patients still getting taken care of. So what I'm over here breaking my back for when ain't nobody else around here doing nothing? Like, and it became like even just a task with, because, you know, especially in intensive care unit, you want to make sure your patients are turned every 2 hours. You know, if you've got somebody with diarrhea, then their sheets have to be changed. And even if they don't have diarrhea, like, you wanted to make sure that your patient every day had clean sheets and that they had a bath and different things like that. But if you don't see other people doing that with their patients, and, you know, and they're fine, and if the patient is awake and they don't have a problem with it and their family doesn't have a problem with it, it's like you can just kind of become complacent and be like, well, you know, they're getting away. And especially if nobody ain't saying nothing, if the supervisor ain't saying nothing, if the charge nurse ain't saying nothing, then it's really easy to kind of get caught up in that, especially if you're tired. And you are going to be tired. Like, if you're working 312s, or especially if you're doing overtime, you know, you're going to be exhausted. But I just really kind of want to do this video to challenge you to not be that person. Like, still go, like, have that healthy balance. Like, definitely go above and beyond for your patients when it comes to listening to them, when it comes to advocating for them, when it comes to, like, making sure that they have, like, the basic necessities. Like, you want a bath every day, so you need to give your patient a bath every day. You know, if the sheets are dirty, like visibly dirty, like soiled, or, I mean, like visibly soiled, like, you would want your bed sheets changed. So change your bed sheets. Like, if you're kind of a neat, clean person, and you see that their room is literally like a tornado went in there, and that could be their own doing, or that could be their the nurse before you's doing, or maybe like there was some type of emergency or something, or some type of procedure done, and people and the doctor or the team just left a bunch of stuff everywhere. Like, I mean, you would, if you're a neat person, you would probably want your room cleaned up a little bit. You're not custodial. That's not necessarily your job, but you would want somebody to kind of tidy up your room so that when you have company and other people come in, it doesn't look like a hurricane just came through. So that's kind of really what I want to, and even just like with, what's something else? Like, even like with little things, like with their IVs and with their wounds, like, cause, you know, on, like, it would only be certain days, like, it would be certain set days that you would have to do stuff. Like, you would have to change your tubing on a certain day. Depending on the wound, like, you may only have to, a type of wound they have, like, you would only maybe have to change the dressing on Monday, Wednesday, Friday. And today you may have the patient on a Tuesday. Or same with kind of dressings for IVs and CVLs. Like, we would only have to change those on a certain day. So, but if you see that drain, that wound is like, the dressing on the wound is like nasty, and you see that their IV dressing is like coming up, or, you know, or the tubing is nasty, like, it's okay. Like, you can do that, even though it's not your day to do it, even though the orders say Monday, Wednesday, Friday, and it's a Tuesday or a Saturday, like, you can still do it. And I think a lot of us, like, start off doing that kind of stuff. Like, when we see a need, like, and it needs to be done, then we do it. But I think, like I said, sometimes we become a product of our environment. We're exhausted, we're tired, we're overworked. And so we're just like, you know what, whatever. But I just want to challenge you to think about how you would want your loved one taken care of. Like, and again, this is circumstantial. Like, there would literally be days in the ICU where I would not sit down, or I would not be able to go to the bathroom. So that's different. That's different. I'm not talking to you if that's you. I'm talking to you if you literally have time to be on your phone, you have time to have a lunch, you know, like, you have the time to do these things, then please do it, because you would want the nurse that was taking care of your loved one to do that for you. And then that was another reason why I was like, I cannot become a product of my environment. Like, I have to go above and beyond to take care of these people. Now I have to go above and beyond without burning myself out. Like, once I get it, now I ain't coming in there every 5 minutes like how I used to when I first started as a baby nurse. I'm not doing that. You better get what you can get. I'm trying to keep track of my time. I got 3 minutes. You can get what you can get when I'm in there. And now if you're asleep, if you're on the ventilator, I may come in there a little bit more often because I need to check on you a little more often. But if you awake, you better get it while I'm in there, okay? I'm not about to be in there every 5 minutes like how I used to. So, but yeah, just think about how you would want your client, your loved one taken care of, and do the same for others. Because I found that what comes around goes around, you know, and you want to treat, and it might not necessarily come around on you, but it may come around on the person that you love. I'm getting my Zoom ready, y'all, because I'm not done with y'all. I don't think I'm done anyway. But yeah, I found that things don't always come back on you, but they may come back on a loved one. And sometimes that's worse when because you like, oh, I deserve that. Like, I rightfully deserve that. But then when it comes back on your loved one, you're kind of like, ooh, like, I hate that. But then, you kind of have to look at yourself in the mirror and be like, that's kind of how I treated people when I was a nurse. Now, me working as a nurse now in this school, oh, I talk bad. I talk bad to them kids because y'all think y'all grown. So I'm gonna talk to you like you a grown person. Now, my patients in the ICU, they couldn't do for themselves. They were sick. They had a legit reason. But these kids, no, you gonna get all the smoke. Especially if I ain't in the mood and you coming down there with some foolishness. Like somebody yesterday came down there asking for pickle juice. I don't have pickle juice, and you need to get on somewhere before I slap you. So that's a little different. Of course, you want to be mindful of your environment. So, but I'm talking about if you're working in a hospital setting, just make sure that you treat your patients the way that you would want to be treated. Don't become a product of your environment. Continue to work hard, especially if that's who you are to the core. Keep that work ethic because it's not in vain. Like, people are watching you. People watch how you treat your patients. People watch how you treat family members, and they admire that from a distance. They may never come up to you and say something, but you never know like what the future holds. Like, the person that may be watching you and may not be saying anything, like they may be your interviewer for a job in the future. Because like I thought I was going to be in the ICU forever, but that was not the case. And so you never know too if that's other people's cases, where they migrate to in life. So just keep that in mind, that you need to don't become a product of I forgot where I was going with this because my mind is all over the place because I got notifications coming about my Zoom getting ready to start. But just main thing is don't become a product of your environment. Work hard. If it's a toxic environment, work hard. Treat your patients right. You never know who's watching you. And just do your best to come to work being the best version of yourself. Like, do what you can. Try to get enough sleep. Try to eat right. Like, take care of your body. Drink water. Like, do as much as you possibly can to be the best version of yourself when you are at work, so that you can work hard, that you can take care of your patients to the best of your ability. So that's the word for today. Let me know if there's anything else that you all want to talk about. I can pretty much talk about pretty much anything. So I've been a nurse since 2017, so I know a lot about nursing. So if you have any questions, of course, let me know, and we will talk soon.